everyone, and welcome to the program. I'm Christiana Manpour. Police have sealed off the house of a Texas nurse after she has become the first case of Ebola spreading within the United States. She'd been treating Thomas Eric Duncan, who died of the disease last week. Spain is on edge too, as a similar case is under investigation there. The latest from the Centers for Disease Control, which leads the fight in the United States, is that it admits more cases may develop and safety protocols may have to change.
We have to rethink the way we address Ebola infection control, because even a single infection is unacceptable.
While here in Britain today, thousands of healthcare workers went on strike for more pay as the health secretary warns there is little doubt, quote, that Ebola could break out here too. Meantime, the worst hit remains Liberia, and now doctors and nurses there are threatening an all-out strike. There are not enough of them, they say, they don't get paid, or they don't get paid enough, and they're exhausted after trying to combat this disease since April. As Naima El-Bagir now reports for us from Monrovia.
Racing through the streets of Monrovia, an ambulance transporting a suspected Ebola case. Inside, a scared and helpless patient. He waits and waits, and no one comes. This is the reality of a system on the brink of collapse. Over the weekend, angry healthcare workers clashed with the Liberian president over wages.
What we're trying to make sure that you get, okay?
They've had enough. Hazard pay and improved equipment among the demands. A work slowdown is in effect at 2 of the city's 4 treatment centers, and they're threatening to strike if the demands aren't met. Ambulances have already been turned away here.
Currently, you have 3,000 deaths multiplied out by 5, so you have 15,000 deaths in the next 4 weeks if this is not handled very soon.
So given those consequences, why do you still want to strike?
I don't want to strike, but the president has to listen to the mass of health workers out there. They are angry people. You don't want to have angry people knocking at your doors during this kind of emergency situation. So the president has to listen and act very fast.
An overstretched healthcare system beginning to crack when it can least afford to. The president personally now asking healthcare workers to stay on the job. Doctors Without Borders, MSF, run the city's 4th treatment center, the largest in the world. But they are nowhere near full. Not because people aren't getting sick. The worry is it's because they may no longer be coming forward.
So now we have enough beds, but the system is not good enough, and it's taking time to rebuild the trust in the system.
Trust that they won't be turned away like so many have in the past, and that they'll get the treatment they need. Rebuilding that trust is another layer of complication, and one that could undo what gains have been achieved here. A lot has been said about the international community's response, but these are the men and women who have been risking their lives and staunching the wounds since the beginning of this crisis, and now they're asking that the world does not forget about them. Pause, and the ambulance remains waiting. Naima El-Bagir, CNN, Monrovia, Liberia.
And just as troubling, there were only 2,348 known cases of the deadly Ebola infection ever. That's prior to this latest outbreak. Now there have been more than 4,000 deaths, almost all of those in Liberia, and more than 8,000 cases. The UN appointed a special envoy on Ebola this summer to coordinate what is a global crisis. And Dr. David Nabarro recently returned from Liberia, and he joined me earlier from Geneva. Dr. Nabarro, welcome to the program.
Thank you.
We've just listened to this rather devastating report from our correspondent in Monrovia that at this worst of all possible times, health workers, doctors, nurses are going on strike there. The president is having to plead with them not to. How devastating will this be?
This is really serious news. Really, the health workers in Liberia, Sierra Leone and Guinea are really at the front of the effort to confront the Ebola outbreak. And I quite understand that for many of them it's a devastating moment. They've seen their colleagues getting sick and in some cases dying, and they're finding it very difficult to sustain work. They want to be properly recompensed for the extra risk that they face, and sometimes they feel they're not given what they require to enable them to do the work, and that leads to this kind of action being threatened. I hope that they find a solution and it's not going to occur.
Meantime, let's talk about the actual state of the disease right now.
Yeah.
I heard you this weekend on the radio say that you hoped that this could be contained within 3 months.
Yeah.
Do you still believe that, and what gives you that hope?
The moment we see an outbreak that's doubling in its extent about every 4 weeks, the international community is coming in with an extraordinary and totally unprecedented response. Some countries like the United States, the United Kingdom, are bringing in large numbers of people, both skilled doctors and nurses, but also people to help with logistics and emergency management, and they're also providing vast amounts of money. Other countries are coming up with similar big contributions, in some cases like Cuba, large numbers of doctors and nurses as well. It's with this very intensive support that I believe it will be possible to get ahead of the outbreak, and our estimate, this is the whole of the UN system, is that we should be able to bend the epidemic curve down and start to see the outbreak coming under control by the end of the year. That's 90 days from the 1st of October.
And what does coming under control mean? How do you identify that?
At the moment, the outbreak curve is increasing exponentially. That means that with doubling every 3 to 4 weeks, it's going up in an upward direction like this, and to deal with that, you have to have a very, very large response. And what we're waiting for is the time when the curve reaches its peak and starts to descend. That's coming under control. Being fully controlled is when transmission completely stops, and that'll take a bit more time after the end of this year. Of course, this is our anticipated result. It's our objective. We do need to make sure that we can get all the resources in place in time to support the governments with their response. And if anything gets in the way, then it may be difficult to hit that target.
Right, and you talk about, the transmission coming down. Today, the head of the CDC's, Dr. Frieden, has said that they must break the chain of transmission. Their most important objective is to prevent the spread to Americans, and to do that, they need to stop it at the source.
Absolutely correct, yes.
So a couple of questions then. Already we're seeing unintended, unexpected cases in the United States. One Liberian man has died, one nurse is affected, or rather infected, and she is being monitored. If they are having trouble containing it, if they're having trouble with protocols, if they're having trouble, and now the CDC is saying we have to totally rethink how we approach the protocols. In the United States, how on earth can you get a grip in Liberia, Sierra Leone, Guinea?
Well, I want to stress that there have been several outbreaks of Ebola in the world in the last 40 years since the virus first appeared.
And this is the worst, Doctor.
This is far and away the worst one we've ever seen. But I want to stress that when groups are disciplined and apply the protocols rigorously, infection rates amongst health workers are very low indeed. But it's a very difficult virus to deal with. It can get its way through any break in our defenses.
Do you think there should be excessive and extensive new special training? We're hearing from nurses in the United States that they don't really get special Ebola training, just maybe a few things posted on a billboard saying do this and do that, a few diagrams about gloves and protective clothing. And do you think there needs to be special hospitals committed just to this infection at this time?
Well, certainly in the countries that are affected in West Africa, the Ebola outbreak is being dealt with through specialized Ebola treatment centers run by teams who are totally disciplined with the application of the protocol.